This is a coronal section of cirrhotic liver. For comparison, there's a portion of normal liver, also sectioned in the coronal plane, with attached pancreas. Cirrhosis is a final common pathway for a variety of chronic liver diseases. The major etiologies of cirrhosis are chronic viral infections, including hepatitis B and C, alcoholic fatty liver disease, and non-alcoholic fatty liver disease. Cirrhosis is characterized by dense fibrosis with abnormal regenerative nodules replacing the normal liver parenchyma, which you can see here. Here the parenchyma is made up of small nodules with fibrosis in between. The surface of the liver also shows this nodular appearance when you compare this to the smooth parenchyma of normal liver and the smooth surface of the normal liver. The dense fibrotic bands and scar tissue may cause vascular shunting. This liver is small and firm with a diffusely nodular surface. Complications of cirrhosis include portal hypertension, ascites, hepatorenal syndrome, esophageal varices, hepatic encephalopathy, and an increased risk for hepatocellular carcinoma.